Hi, I'm Dr. Eli Langford, and in today's discussion, we're going to talk about pain and the role of pain in ergonomics. So let's get started. By the end of today's discussion, as well as the video assignments that you are asked to watch, you should be able to meet the following learning objectives. You should be able to describe the role of pain, explain how the body signals pain, be able to discuss the transition from acute pain to chronic pain. You'll also learn some terms like compensatory movement patterns and what are the possible outcomes of those, as well as be able to explain changes in brain and body functions in a chronic pain state. So in this slide presentation, we're specifically going to talk about the role of pain, acute pain, and transition to chronic pain. So pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So pain is typically a symptom of an underlying condition. All right, and it's important to think that pain is a normal human experience. What would happen if you didn't experience pain? Well, let's give an example. Suppose you're walking down the street, and we could think of like humans, thousands of years ago. I guess there weren't streets thousands of years ago, but you get my point. So you get somebody who's walking along, they don't have shoes, and they step on something sharp. Well, the signal is sent to the central nervous system that there's something sharp, and the central nervous system decides what to do about it. And in the case of something sharp, typically you get a reflex response, which would pull your foot away quickly so you don't further embed that object into your foot. What would happen if you didn't have a pain response? Well, then you might incur even further injury. So think of pain as a normal experience that helps our bodies understand when something is problematic. Pain is a type of a somatosensory feedback. And this is a term that you guys don't necessarily need to know, but realize that we have different sensations of proprioception. Basically, anything that's giving the central nervous system feedback of the environment. Well, before we get too far into this, I want to make sure that we understand some of these anatomical and physiological terms and the tissues, so that when we talk about pain or when we have people give videos or special presentations, if they talk about things, we know what they're discussing. So muscles, this is probably common sense for most of you, but muscles are the proteins in the body that contract and cause changes in movement. Okay, and we have the muscles are made up of these little amino acids, which make up different proteins like actin and myosin. And actin and myosin are the two proteins that contract together to cause movements in the muscle. All right. Tendons at the end of the muscle are tendons attach onto, at the end of the muscle has this area called the myotendinous junction. Myo means muscle, tendinous, obviously the tendon. Junction is the area that the tissue transitions from a muscle to a tendon and then attaches onto the bone. So at the end of your muscles, you will find a tendon, and that tendon then attaches onto bone, so that when the muscle contracts, it pulls on the tendon, and then the tendon, which is attached to the bone, causes the bone to move. So in the case of like an arm, the bicep contracts. At the end of the bicep, you have a tendon that attaches onto the forearm, and as it contracts, the arm would then move. Ligaments, on the other hand, they attach bone to bone, and so their job is more structural, if you will. They hold things together. So if you tear a ligament, that means you're going to have some sloppy play in between bones. If you tear a tendon, you're going to struggle with movement because the muscle can't move the bone appropriately. And then nerves are what send the signals to and from the central nervous system. And then the last thing that I want to discuss is something called the fascia or fascia. And fascia is actually more people call it fascia, but fascia is a white connective tissue sheath that surrounds pretty much everything. And so if you were to look at cadavers, around all the muscle tissue, around organs, you're going to have this fascia. And it's this white connective tissue that doesn't have actin and myosin in it like a muscle does, so it doesn't contract. And for a long time, we didn't understand really the role of fascia more than just it's a sheath that kind of surrounds everything. But more recent evidence is showing that somehow the fascia can kind of get more tense. And I don't know if you've ever heard of fascial release. Some therapists will do stuff like that, trying to get the fascia to not be so tense. Usually if there's an issue with fascia, it's a response of injury. So this will come up in some discussions, especially videos along the way. I just wanted you guys to understand it. We don't know a whole lot about fascia still. It's relatively unknown, especially the contractile component of it and how that occurs. But we do know that it does, with injuries, you can get some fascial limitations. So this is a picture of what we've just talked about. So this would be an example of the bicep, and this is your elbow, this is your forearm, and this would be the muscle here. And you have these proteins along here that they can contract and cause this muscle to shorten up. So the actin and myosin would interact and shorten up. You have, this would be called the myotendinous junction right here. It's where it goes from muscle to tendon, and then you have the tendon which attaches onto the bone. So as this muscle contracts, it pulls on this bone here, which would pull the arm upright. Now, attaching bone to bone, these are ligaments. And ligaments are, again, not involved so much with causing a movement to occur, but more limiting movement between bones, keeping things connected together. And then we have the nervous system. And so the example here would be a sensory nerve. So this would be our skin. And let's suppose that if I have a coffee cup in front of me, which I have one right here, and I reach down and I touch the cup. If I had my eyes closed, how would I know when I actually touch that cup? Well, because I have sensory nerves in my fingertips, and when those sensory nerves go off, a signal gets sent up this afferent nerve. So afferent goes towards the central nervous system. The central nervous system then decides what that means. And that's where the whole proprioception thing occurs. You ask a little kid to close their eyes, touch their nose, they might struggle with that. As adults, it becomes much easier because we've done it so many times. We know that X amount of signal from a nerve means so much movement occurred, okay? And as you get older, especially through your developmental years, those proprioceptive responses become better, more tuned in, if you will. So in the case of the coffee cup, I know when I'm touching something. I know how much of a signal I need to send from the central nervous system out to the muscles through an efferent nerve. Efferent means, think E for exiting the central nervous system, to then cause my muscles to contract and bring that coffee cup up to my mouth. So we have these afferent nerves that sense what is going on. So in the sense anything that's going on in our surroundings. They also sense things that are going on inside of our body and send a signal up to the central nervous system. So think any nerve that sends any type of signal up to the central nervous system, that is an afferent nerve. And then the response of the central nervous system occurs through efferent nerves that go out to the tissues. So let's give an example of how these sensory nerves might work. I was in the Amazon one time, and I was walking down a path, and a leaf came down and hit the back of my neck. So I didn't see that it was a leaf. So what are the possible options that could have been? Well, all my central nervous system knew was that there was a signal on the skin, and it went to an afferent or sensory nerve sent that signal to the central nervous system. Well, in my mind, I thought that had to be a snake. So the central nervous system decided that it was a snake and did a response accordingly. So how would that have changed if I'd have seen that it was a leaf? Okay, so my point with this is that the afferent nerve does not determine the response. It just sends the signal to the central nervous system, and then the central nervous system determines the response. The reason this is important is when we start to deal with chronic pain. You might find that a weak signal can cause a big response from the central nervous system. Or maybe a big signal doesn't cause much of a response in the central nervous system. The central nervous system decides for itself what the response is going to be. Okay? There might be, if somebody steps on something sharp, one person might jump very profoundly in the air, the other person might just barely move their foot a little bit. Okay? So your perception of the environment, what's going on, what the central nervous system determines is going on is how the response will be. All right, let's go ahead and continue on here. So the role of pain, it's an attention to painful stimulus is prioritized over other senses to help protect the body from injury. So think about that. So pain receptors, they take priority because often pain is associated with damage and we want to prevent any further damage. So it tells your brain that action is required. So in the example of this here, if you were to touch something that was hot, maybe you visually didn't see that it was hot, you touch it, a signal goes up that says this is what's occurring. There's this type of pain is happening in the hand, and then the brain goes, I got to pull my hand away. Okay, what if you still wanted to hold on to what it was? Can you override that response? Absolutely. The central nervous system determines what is going to happen. Okay, the sensory nerves just send that signal up. But typically, pain is a way that the body protects itself from further injury. And so we could have a quick reflex movement, or you could have, in the case of, say, you hurt your back. The pain, if you hurt your back, would be, I'm going to not move. That's going to be the response that the central nervous system does. If you've ever bent over and all of a sudden you tweak your back and you kind of stop and freeze, okay, it's because the central nervous system decides what the type of response is going to be based off of the stimulus. So pain is letting us know that something is wrong. So especially acutely, don't look at pain as a bad thing. Look at pain it's our body telling us that damage is occurring. So when we're dealing with acute musculoskeletal injuries, and acute means short term. So something that happens, like if I stepped on a tack, that's an acute injury. It was very short, and that signal goes up to the brain. I decide what to do about it. They typically involve muscles, tendons, ligaments, and bones. And then we have what's called an immune response. And often we think of immune system as far as like vaccinations or allergies or things like that. But swelling is also an immune response. It's our body's way of attacking something that's wrong. And in the case of often with damage, is what's wrong is tissue damage. And so swelling occurs to go in. It's part of that process of helping to break down old tissues and replace it. So decreased use of the injured area helps to promote healing. So with pain, we often start to have compensatory movements, which means we do other movements to compensate for the pain in which we are experiencing. So compensatory movement strategies are used to achieve a task, but not to pre-injury form. So an example might be you sprain your ankle. You're out in the field walking and you sprain your ankle. How do you change your walk so that you have less movement in the injured area? Well, you might only step on the injured foot for a fraction of a second and then bring the other foot forward more rapidly. You might not put weight on it. You might be having your toe down as opposed to having the full heel. These are compensatory movements. We could think about shoulders. If you have a torn rotator cuff, you lose the ability to lift the arm in certain situations. So if you have a hat on and you need to mess with the hat, people will typically keep their elbows tucked in and try to just move the forearm up and down as opposed to messing with their shoulder. So the body does compensatory movements to help limit movements in the injured area. Now, this is a short-term relief. If you don't take care of the injury and you continue a compensatory movement for long periods of time, then these can start to become more of a permanent movement. And these compensatory movements are not designed to be long-term. And so you can start to get imbalances in muscle tissues, which can cause even further problems within the body. And this can cause a transition to chronic pain. So what is chronic pain? Well, the other thing is we need to define what is chronic versus acute. And as I talked with different experts, looked at different scientific journals, there was not really a consensus on what is considered chronic, but most of the time, 3 months tended to be their definition of chronic pain. Okay, so what is happening with chronic pain, and how is it different from acute pain? Well, acute pain was often that first injury, the signal goes, and it's different than what the body was receiving before. I didn't have pain in my foot. I stepped on a nail. I have pain in my foot. Okay. When this starts to transition to months of this, then it can change the way the brain and body actually, the way that the nerves work. Because remember, the central nervous system decides what to do about it. Okay. So when we had a pain we weren't used to, the central nervous system was very quick about moving that foot away. Long term, what is the pain that we're experiencing? We're experiencing something like the damage isn't going away, and so the body is starting to try to disuse that area. Like we said, limping. Now all of a sudden you have a permanent gait change or walking pattern change. It actually starts to change the way the brain processes information. And I know that sounds really weird, but a great example of it is PTSD. With a lot of military people experience this. And they showed that when some people experience PTSD, the sensory nerves that sense touch, sometimes the brain can start to perceive that as pain. And so you feel pain because the brain is what processes what's going on and decides what to do about it. And so it literally changes the way the brain deals with the sensory information. And you might find that very little, maybe the damage actually goes away completely, but the brain still senses that there's pain and causes it. That's why it's so important to address chronic pain, is because chronic pain can lead to changes in the brain and the way that the nerves will still send signals the same. It's the way in the central nervous system processes it. So if we look at short-term versus long-term pain, we have here the pain or injury or the threat of pain, okay? What that does is it changes at multiple levels of the nervous system, redistribution of activity. So in other words, you start to change the muscle activity. Limping, for example, changes our mechanical behavior. We're going to get increased stiffness. But the short-term benefit of dealing with the pain is it protects the injured part. Well, what happens if that stays long-term is that it keeps this process going and the brain starts to get accustomed to this process in a way. So chronic pain reflects changes in the brain. This is from a study. It says chronic pain is interpreted as a consequence of peripheral and central reorganization. And peripheral means any nerves outside of the central nervous system. So peripheral nerves and central nervous system reorganization that leads to a switch from a bottom-up condition where nociceptive inputs dominate to a more top-down state where pain behavior is controlled by emotional and cognitive values. So when we mean top-down, we mean from the central nervous system out to peripheral, versus that the brain's getting its information from the bottom, which would be the sensory nerves. So chronic pain brain. Chronic pain could be considered a cognitive state. Chronic pain competes with other emotional and cognitive abilities. Think about that for a moment. People who have chronic pain are often less consistent on decision-making tasks because we're dealing with the central nervous system, which involves the brain. You get changes in the prefrontal cortex in people with chronic pain. It leads to changes in the way that we plan, in the way that we move. It changes emotions. It changes, you can start to see increased states of anxiety and depression. So chronic pain is something that needs to be dealt with appropriately. All right, and finally, pain changes muscle recruitment patterns. You have it with decreased perception of function because of the pain. There's a learned expectation of pain with movement. And so if you think that you're going to experience pain when you do a certain movement, then you will start to change the recruitment patterns of the muscles. The brain will start to change what it would normally recruit. Normally, if you're walking, you're going to recruit right leg, left leg equally in sequence. But if you have chronic pain and it wants to avoid the pain, it's going to start to change how much it recruits one muscle or leg versus the other one. And research has shown that you get changes in muscle recruitment with chronic low back pain, with shoulder injuries, with neck pain. I'm sure many of you have experienced some of those things. And that's so the point of this whole discussion is that pain is a sensory system that helps the body understand when something isn't right. And so our goal is to try to deal with the pain and resolve the pain so that it doesn't progress into chronic pain. Because when it progresses into chronic pain, then you have another thing that you have to deal with. You have to learn how to get rid of the regular pain, and then you have to deal with any form of the mental changes, or we could say the central nervous system changes that took place. So hopefully this helps you understand pain a little bit better. Watch the videos, and if you have any questions, again, feel free to email me. I do recommend, please don't make comments to me in Canvas. It's a great idea, but the Canvas system does not allow me to reply to your comments in Canvas. So if you just want to make a statement in Canvas, by all means, send that to me through Canvas. But if you want a reply, please go ahead and just email me, though. So anyway, that's what I have for you today. We'll see you next time.